The opinions and views expressed on this program do not reflect those of the management or staff of Community Media of Staten Island.
Welcome to this edition of Vital Signs. Glaucoma is often called the silent thief of sight because it can damage vision without symptoms. Today, we'll break down what you need to know and important steps you can take to protect your vision. We'll also show you how a glaucoma screening is performed, tackle common myths and misconceptions about the disease, and speak with Visions, a nonprofit organization making a difference for those affected by vision loss. Joining me now is RUMC's Chair of Ophthalmology, Dr. Aisha Hasan, and ophthalmologist, Dr. Joseph Muscente. Dr. Hasan is a board-certified ophthalmologist who is fellowship trained in corneal and external disease. Dr. Muscente is an optometrist at RUMC since 2020 and has been published multiple times, including articles on ocular disease and trauma. Recently, also co-authoring a textbook entitled Complex Cases in Clinical Ophthalmology Practice. Welcome to the show.
Thanks for having us.
Yeah, thank you for having us.
Thanks for coming on. So, Dr. Hasan, for those that don't know, the obvious question, what is glaucoma?
So glaucoma is what we call an optic neuropathy, and in layman's term, that basically means that there is damage to your optic nerve. The optic nerve is what connects your eyeball all the way back up to your brain. We don't exactly know what causes the damage, but we do know that lowering the eye pressure can help prevent disease progression.
And how and why does it cause vision loss, and why does it go so unnoticed for so long?
So the reason that it causes vision loss is because the optic nerve, as understanding from its connection to the brain, is really important for vision and for sight. There obviously are other parts of the eye that control that, but that is the main neuronal layer that provides us sight. And so the way that it goes unnoticed for so much time is the way that glaucoma occurs and the damage to the optic nerve happens. It affects mostly your peripheral vision. So the loss of the peripheral vision initially is not seen, and then slowly, as it becomes more and more advanced, the vision starts to decrease. People might start to see things becoming dimmer or shadow, and then at that point, unfortunately, that means that the glaucoma has progressed to at least a moderate to severe stage.
And Dr. Muscente, who's at risk for glaucoma?
Well, it's really anyone who's over 50 or 60, somewhere around the 50th or 60th year is when you start to see some glaucoma changes. African Americans, Hispanics, Asians also are prone to being more prevalent to glaucoma. Anyone who has any vascular problems, like a diabetic, a hypertensive, those are all the people that really need to be checked regularly, not just for their high blood pressure and their diabetes, but also to make sure that the vascular changes that are happening throughout their body isn't causing glaucoma to start and progress.
Is it a genetic disease?
It is genetic. The genetics are a little bit cloudy about who and why and how it's caused, but there are some genetic components, yes. I myself have glaucoma. My mother had glaucoma as well. And this is before Dr. Hasan came on board. I was shocked to find out that I had glaucoma. So, I take my eye drops and everything is okay.
Did you experience symptoms? Or?
I had absolutely no symptoms.
Really?
And which is even more frightening because I'd like to think that I know a little bit more about the eye than most people. And I had absolutely no symptoms whatsoever.
Wow.
Yeah.
And so how do you make a diagnosis of glaucoma?
Like, a diagnosis of glaucoma really happens through a regular eye exam. We look at a lot of things. The first thing we look at is the condition of the optic nerve. There are certain changes that we see in the optic nerve that would make us suspicious or sure that a person has glaucoma. We check eye pressure, not blood pressure. A lot of people think it's the same as blood pressure, and it's really not. We check the eye pressure to make sure that the pressure is within the normal range for most people. Some people can have an eye pressure that's a little bit higher, but that's their normal, just like some people have a blood pressure that's 140/90 for many, many years and nothing ever happens, fortunately. People who have thin corneas, and Dr. Hasan's a cornea specialist, are more prone to glaucoma damage. So visual fields are important, and that's a computer test that tells us how you're seeing, because glaucoma typically starts out here and moves its way in. So that would pick up on certain patterns that we see that the person is seeing that we just can't see by looking at their optic nerve. And also recently, I say within the past 10 years, like the OCT, ocular computerized tomography, which gives us a really good view at the different layers of the eye and tells us even before we can see anything many times, that there is suspicion for glaucomatous damage happening, even before we see any vision loss, which is important.
And since you mentioned, what is normal eye pressure and what would be glaucomic eye pressure? I don't know if that's a term or not.
That's a really good question, and for the most part, we'd like to see eye pressure under 21, 22. But like I mentioned before, people can have eye pressure of 22 or 23 and still be normal. So it kind of ranges it varies from person to person. But when we see a pressure creep up around 22, 23, 24, then we will become suspicious of glaucoma starting. But it really just depends. You have to look at the whole picture. What does the optic nerve look like? What do the visual fields look like? What does the OCT look like? What is the pressure like? Is there a family history? You know, so those are all the things all the pieces of the puzzle that we put together to definitively say, yes, I think this person has glaucoma and needs treatment.
Gotcha. And Dr. Hasan, are there different kinds of glaucoma?
So there are different kinds of glaucoma. The most common glaucoma, which is what I think people routinely hear about or are concerned about, is what we call open angle glaucoma. And so, you know, if we think of the eye as a circle, and, you know, there are these little corner crevices, which we call the angle of the eye, which are responsible for fluid leaving the eye, and that controls the eye pressure. And so primary open angle glaucoma is when everything in the eye looks pretty normal, but the eye pressure is becoming elevated, and that is leading to some sort of vision loss for patients. Other forms of glaucoma are very rarely there's a congenital glaucoma that babies can be born with, where their eyes are very cloudy and the pressure is very high. It's a very different management when it occurs at that time. Another type of glaucoma is when those angles that drain the fluid become closed, and either that can happen in an acute or in a chronic setting. In an acute setting, that might be what people, you know, are told are emergencies, and you know, the eye becomes suddenly very red, very painful. It's a very acute rise in the eye pressure. You can see your pupil being very dilated, and that usually requires like pretty urgent to emergent treatment. But those are all much rarer. The common type of glaucoma is open angle glaucoma.
Gotcha. And now that we have the background on glaucoma, we're going to take a quick break. When we come back, we'll talk about how a quick and easy glaucoma screening test can make a world of difference in detecting the disease at an early stage. Stay tuned.
Every day, signs warn us of danger, but often, hepatitis B won't give you a warning. Hepatitis B often doesn't cause symptoms. 1 in 12 Asian Americans is infected with hepatitis B, and most don't know it. It is not spread through air or by sharing food or utensils. If left untreated, it can lead to serious liver problems. Testing is the only way to know if you have hepatitis B. Talk to your doctor today about getting tested.
Welcome back. A quick and easy screening test can detect glaucoma well before symptoms appear, preserving vision and affording time to begin treatment right away. Today, we're going to discuss two different screenings that are available, one that is done in the office and one that Richmond University Medical Center conducts at community events throughout Staten Island. Dr. Muscente, talk a little bit about how you actually diagnose. What's the technology? How do you diagnose someone for glaucoma in the office?
In the office, if a person has no problem sitting up or getting behind a microscope, we use something called Goldman applanation tonometry. And that's pretty much the gold standard in measuring glaucoma pressures. What we do is we use an eye drop to numb the front surface of the eye, and we use a little prism that's, we light up with a blue light to actually touch the front surface of the eye and measure how much bounce back.
So you're actually touching the eye.
We're actually touching the eye. That's
It
where
sounds-
the anesthetic. Yeah, it doesn't hurt at all. You don't even feel it being done, and it works just the same way as a tire gauge does. It measures the amount of air you have in your tire. Same thing that this gonion prism does, and it will help us look at the pressure and put the whole piece of the puzzle, all the pieces of the puzzle together to say whether or not we think this person is either a glaucoma suspect or in fact does have glaucoma.
And that is measured just by that device touching the eye? Is that how it's done?
Correct, yes. So it touches the front surface of the eye, and what we see when we look in there are the two semicircles. We line them up, and we pull back, and that's the pressure on the side wheel there.
Okay.
And we can record that pressure.
Huh. And Dr. Hasan, glaucoma test used to be the puff of air, right?
Yes.
How did that detect glaucoma?
So it used to determine like the amount of, the same way with the tire pressure, the amount of kind of bounce back from that puff that would give you the pressures in mercury of your eye versus, that puff against it. So kind of was like a measurement against a baseline, but it was very unreliable because with the puff, people would close their eyes or they would move, and so it would give you sometimes an erroneous measurement, especially also some people in the anticipation of the puff would like hold their breath and their pressures can
Guilty, you have it right here, absolutely.
be artificially elevated, so that has unfortunately moved out of favor. Well, fortunately for some.
Yes. Well, I know people that would like not go for eye exams
100%.
because they were afraid of the puff of air.
We do actually now have even more advanced technology. It's not as accurate as the Goldman tonometry, but in terms of community settings or with children, it is called the eye care. It measures the eye with a small tip that is kind of only feels like a feather. So you actually, some people can say you don't even need to use any anesthetic when using it to check the eye pressure. It does like gently touch the eye, but you don't feel much of it because it's so
And
thin.
that involves dilation, the one in the office that we're talking about right now. You have to dilate the eyes, so it's like don't drive after having the test done. Right?
So the dilation is not necessary for checking the eye pressure, but it's necessary for the whole eye exam, to check the health of the optic nerve. So, there's one thing that we look at, which is the size of the cup of the optic nerve, which Dr. Muscente kind of talked about earlier, which if enlarged in some people can make us suspicious about glaucoma. And so that we need to dilate the eyes for to take a good look at that.
Now, we have, and you've done this at many community events that RUMC has been at, you also are able to do a glaucoma test outside the office, which doesn't involve dilation. So how do you do that?
So we use the machine that Dr. Hasan was just talking about, the eye care, or which basically allows you to check the pressure without even having to instill an anesthetic. So it's quick, it's painless, and it gives you a really good ballpark figure of what the pressure is. And typically if we see something that makes us suspicious, we will tell them to come into us and we'll do a more thorough investigation of the back of the eye to make sure that we're not missing anything. But it's portable. It is expensive, right? They are expensive. But
good things in life are.
it's really good, especially for community service things like this. It's also great for patients who are inpatients in the hospital who can come down to the clinic and sit behind the microscope. We can take that technology to them in their beds and check things that way.
So it sounds like the puff is gone.
Puff is
And you either go to the office or you can go to a community event that RUMC's at and you can get your vision checked.
correct.
That's great to know. So as you've heard, RUMC offers these free glaucoma screenings and a variety of other health tests to community groups and organizations. To learn more and schedule a screening, call 718-818-2309. When we come back, we'll tackle a few misconceptions about glaucoma in our Myth versus Fact segment. Stay tuned.
Jason, let's go see your room.
How is it? Is it good?
Welcome back. Now it's time for Myth versus Fact. Glaucoma is surrounded by a lot of misconceptions, and believing the wrong information can delay diagnosis and treatment. So let's start separating fact from fiction. So I'm going to ask you a couple of myths versus fact. You can tell us whether it's a myth or a fact, and just tell us a little bit about why. So Dr. Hasan, our first myth versus fact. Glaucoma only affects one eye.
So that is a myth. Glaucoma can affect both eyes. Sometimes it can be uneven, where one is more affected than the other, but typically it is a bilateral disease, yeah.
Dr. Muscente, to you. Myth versus fact. Wearing glasses or contacts does not prevent glaucoma.
That is correct. That is a fact. Wearing glasses or contact lenses will correct your vision, but it does not really affect your eye pressure or anything about glaucoma.
So your contact or your glass prescriptions will increase over time as the glaucoma.
Yeah, well, you could have both at the same time, certainly, but they're really not related in any way.
Gotcha.
Although there's a little bit of a snafu here. People who are very farsighted, people who have trouble really seeing up close and even out in the distance, can sometimes be more prone to glaucoma based on their anatomy. So it is a fact with a little snafu.
Okay. So if you're farsighted, they should tell you that at the exam because.
Well, you'll see it hopefully. Yeah.
Right. And Dr. Hasan, myth versus fact. Once vision is lost from glaucoma, it can be restored.
So that is a myth. Unfortunately, we do not at this time have anything that can correct glaucomatous damage. So once the vision loss has occurred, it is unfortunately permanent.
Dr. Muscente, myth versus fact. Glaucoma only affects older adults.
That's not true. It is more likely. Well, it also depends on your what you think old is. As I move up the dial, it does more affect elderly people. Typically 50 plus ish are more likely to get glaucoma. So they should be more inclined to get their eyes checked as they get a little bit older. Certainly over 50, you should be getting your eyes checked every year.
So to both of you, so do you find that because of that misconception that it's an older person's disease, I'll say, that people just don't go for eye exams at a younger age when they probably should?
That is possible. I find, especially younger, like teens, 20s, they don't routinely come to the eye doctor unless they need an update in the glasses prescription or contact lenses, or unless there is an injury or something that they notice. But like Dr. Muscente said, it is pretty rare to find something like glaucoma in a younger population like that. So most of the time they are okay, not routinely following up. But I do counsel my patients who are younger to at least every couple of years get their eyes checked.
And also, remember, it doesn't really have any symptoms.
True.
So it doesn't hurt, doesn't make you red, burn, itch, tear, none of the things that people come in for. So there's nothing to really, for them to come in for if they're seeing well.
And Dr. on the next one, myth versus fact. If glaucoma runs in your family, there's nothing you can do to prevent it?
So kind of a fact, because it is genetically correlated. So sometimes if you do have glaucoma running in your family, sometimes you cannot prevent it to occur in yourself. It is not 100% linked. So if your parents have it, not all of the children or your siblings or you are guaranteed to have it. But I think the one thing that you can do to prevent severe vision loss from glaucoma is if somebody in your family does have glaucoma, getting more routine eye examinations is something that will really, really help stop that earlier, catch any disease progression from earlier.
Great. And Dr. Muscente, the last one, and I think we kind of answered it, but myth versus fact. Even if you have no vision issues, a routine eye exam is still important.
That is definitely true. Routine eye care, especially in the glaucoma realm, is so important because, again, there are no symptoms. So most of the times when, and I'm sure Dr. Hasan will agree, when you tell someone that they have glaucoma, they're kind of surprised, right? They're kind of like, really? I'm good. I see 20/20. My contacts are great. And that's good too, but they can happen concurrently. So you really have to check.
Great. Well, thanks for taking us the time for that.
Thank you.
Thank you both for joining me and all you do to protect the vision and health of the community of Staten Island.
Our pleasure.
Thank you.
Thank you.
Up next, I'll introduce you to a nonprofit organization that's helping people living with vision loss.
I know this road is there for me if I'm really free.
Glaucoma doesn't just affect eyesight, it can change daily life. To better understand the impact of vision loss beyond the exam room, we're joined by Michael Cush, Chief Program Officer from Visions, an organization dedicated to supporting, educating, and empowering individuals living with visual impairment. Thanks for coming on the show.
Thank you.
For those of us who's never heard of Visions, can you tell us a little bit about the organization, its mission, and the services it provides?
Sure, yeah. So Visions is going to be a 100-year-old organization.
Congratulations.
Back in June. In just this coming June, thank you. And we provide services to people who have vision loss across the spectrum of legal blindness, and people across New York City, Lower Hudson Valley, Long Island, parts of New Jersey, and Connecticut as well. So pretty much the metropolitan area, in helping them cope with vision loss, whether it be something that's new to them or something that they've been experiencing their whole lives. We provide services in the community, in the home. Some of those services include vision rehabilitation therapy, which is showing people how to do activities of daily living safely and using adaptive tools. We work with them to help navigate their communities, safe street crossings, navigating public transportation, knowing how to use GPS applications on smart devices. And we do a lot with finding people employment, helping them get back into the workforce or enter the workforce as somebody with visual impairments.
So if someone comes to Visions, do you actually, like, say, go to the house and do like an inspection of the house? Do you meet with them? How does someone get the services?
So yeah, a lot of our service referrals come through the New York State Vocational Rehabilitation Organization, which is the New York State Commission for the Blind, Visually Impaired. So more or less, we work with the person first through doing an evaluation, usually over the telephone, and determine what their needs are. Sometimes they don't know what they don't know, and so educating them on the services that are available to them is first. And then if they say, well, you know, I really want to cook and I haven't been able to do that since I lost my vision, or I'm turning into an adult, I'm becoming an adult and I'm getting my own place and I want to learn how to cook because my parents never let me do it. So going to their home, showing them how to use a stove safely, using adaptive tools that exist, you know, microwave that talks, or using Alexa to program their appliances, things like that. You know, that's one of the ways that we generally start getting people into receiving services.
So technology is a big part, you know, AI and Siri and all these other things, I guess, help in a way.
So yeah, so technology is huge. Everybody needs technology now, whether you're, you know, doing a job as working in a flower shop, or if you're, you know, becoming a lawyer. Everybody needs some level of technology. So yeah, there's a lot of built-in accessibility features. Voice over is something on an iPhone that everybody has. There's other third-party softwares that will speak on the computer or magnifying the screen. And so teaching people how to manipulate these programs and use them to the best of their ability, along with all the other typical programs like, you know, Microsoft Suite or Google Suite, or, you know, best practice for using the internet. And yeah, now AI is certainly becoming a big player in not just across the board, but especially in assistive technology, using smart glasses and smart devices.
Does somebody who may have sudden vision loss or sudden onset of it, does Visions offer emotional support or for individuals like that?
Absolutely. So we have trained, licensed social workers on our staff. Some of them can speak through lived experience. Nearly a third of our staff themselves have a vision impairment. So we definitely put our money where our mouth is. And working with people on adjusting to vision loss and coping with vision loss, finding resources that are going to help them, but also helping them manage the stress of, okay, how am I going to work? How am I going to feed my family? How am I going to pay my bills? I used to be a truck driver, but now I have to relearn how to work. So yeah, that's what we do also as part of kind of the pre-employment phase for somebody who's looking to go back to work, or just somebody who's looking to, you know, go back to being as functional as they were before they lost their vision.
And if someone is watching this episode, how can they get in touch with Visions?
So you can reach out to us. You can visit our website. It's www.visionsvcb, Victor Charlie Brown.org, or you can email us at info@visionsvcb.org, or you can call us at 888-245-8333. And yeah, we will assist anybody who lives in the metropolitan area. And if they don't, we can find a resource that's local to them.
Well, thank you for the important work that you're doing and reminding us that with the right support, vision loss doesn't mean a loss of independence or quality of life. Thank you for coming on.
Absolutely not. Thank you.
Again, the number for Visions is 888-245-8333. When we return, we wrap up this episode with some parting information.
What are you looking for?
The bravest person I know is my daughter, Cynthia.
My friend Sean, and he was in the Air Force.
One of the bravest things he ever did wasn't when he first enlisted, it was when he found his first support group.
It was when he asked to move in with me and my mom.
I felt like I was lost, and you gave me a place to stay.
She went on foreign soil. She went to war. But the bravest thing she did is when she asked for help.
I'd like to thank Dr. Hasan, Dr. Muscente, and Michael Cush from Visions for joining me today. For additional information about the vision services available at Richmond University Medical Center, you can contact our ophthalmology department at 718-818-4848 or visit our website at rumcsi.org. You can also follow us on Facebook, LinkedIn, Instagram, and X. Richmond University Medical Center has cared for Staten Island for over 120 years. You can help ensure that care continues by making a financial contribution to the hospital. To donate, visit our website and click on the Donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.
This program was produced through the facilities of Community Media of Staten Island.